Good morning, welcome to Salina Regional Health Center's Morning Medical. My name is Mike Maddock from the Marketing Department at Salina Regional Health Center. Thanks for tuning in. I have with me this morning Dr. Jake Breeding from Salina Regional Surgical Associates. Thanks for being on the show. We're actually going to talk about the trauma side of it and especially with the Salina Regional Health Center's recertification of their Level 3 Trauma Center. So thank you for being on the show.
You bet.
I guess my first question is what stipulates a trauma versus a regular surgery?
I think probably the easiest way to understand what a trauma is just to think about an injured patient. And that's someone that might be involved in a car accident, someone that might have a fall, or when you think about watching TV, the people that are potentially shot or stabbed. So a trauma patient is an injured patient to begin with, but based on the severity of injury and the number of injuries, the more severely injured patients we term trauma patients. And
I'd mentioned the recertification, and I guess I probably should talk, what is involved with that certification. It's not just a rubber stamp, as I understand.
That certification is done by the American College of Surgeons and also the state of Kansas. Every 3 years, the American College of Surgeons comes in and does a very thorough review of our entire program. They meet with all the members of our team and also review a number of charts looking at how we perform taking care of some of our previous patients. And based on that review, they gave us recertified us as a Level 3 trauma center, which makes us a very important player in the state's overall trauma system.
Okay, you talked about the team. Let's look at the team. Who all is involved with a trauma? I'm sure it's a crowded room.
You would think that someone that comes in injured to the emergency room would just be seen by a doctor and a nurse, but our trauma team involves a trauma surgeon, an emergency room physician, at least 3 nurses, one from our surgical floor, one from the ER, and one from the intensive care unit, a respiratory therapist, a radiology technician or an x-ray technician, someone from the lab that can draw blood, and then a security officer and a chaplain. So it's really a very well-rounded and very large team that's there prepared to take care of patients when they roll in.
Yeah, and I think part of what we talked about is that they are ready, and that's one thing about the trauma is that it is called and the team is ready to go, and we're so grateful that you're there for everybody when they are, and grateful for you for watching. For more information on this, please visit srhc.com and like us on Facebook and follow us on Twitter for the latest news and updates.